Time now for Morning Rounds with CBS News contributors Dr. Holly Phillips and Dr. Tara Narula. First up, surprising data on America's newest heroin users. The CDC says over a 10-year span, heroin use has at least doubled among women, young adults, and non-Hispanic whites. Researchers say people hooked on painkillers were looking for a cheaper high. Holly, just how widespread is this?
You know, it's actually shockingly widespread. So the report found in 2013 there were more than 500,000 heroin users, and that represents a 150% increase since just 2007. But Anthony, I think that the most striking aspect of the report really came down to who the new heroin users are. And they represent portions of the population that had been previously untouched by the drug. So there's a surge in use among women, among whites, whereas use is leveling off in some of the other racial and ethnic groups. We're seeing increased use in young people, 18 to age 25, and also in higher socioeconomic groups, households that earn $60,000 or more a year and that have private health insurance.
That is the exact demographic you just wouldn't expect. Are they starting with a less severe drug and graduating?
Right. So one of the interesting things is that the real gateway behind this, the real gateway drug, is prescription opioid overuse and this epidemic that we've seen. And so drugs like Vicodin and Percocet and OxyContin, which are similar to heroin, have similar effects in the brain, are really behind a lot of this increase that we've seen. We know that 75% of heroin users first got hooked on opioids, and opioid users are 40% more likely to start using heroin. That's certainly one driving force. Another is that it is cheaper. So a one-day supply of OxyContin costs about $160. A one-day supply of heroin costs $40.
So what do we do, Holly, to reverse this trend?
Right. Well, you know, Tom Frieden, the head of the CDC, has basically asked doctors directly to try to prescribe fewer prescription painkillers, as little as we possibly can, so that we can sort of stop this cycle of addiction before it even starts. The CDC also wants to expand access to a drug called naloxone in communities and in drug rehabilitation centers. That drug can reverse some of the effects of overdose and potentially save lives. But of course, we have to expand treatment programs and also try to slow down the drug distribution.
This week, the FDA approved a new drug for treating heart failure. In trials, the drug helped reduce the rate of cardiovascular death and hospitalization related to the condition. As a cardiologist, I mean, this seems like it would be a very important drug.
It is, and I think to understand why, you have to understand the scope of heart failure. 5 million Americans in this country suffer from heart failure, over 1 million hospitalizations a year, $30 billion a year in costs to our economy, and 50% of the people diagnosed with heart failure die within 5 years. So we haven't had a new drug for heart failure in about a decade, until this April when we saw the release of Korlynor. Korlynor only reduced hospitalizations. This drug, Entresto, reduces both hospitalizations and deaths by about 20%.
So who's going to be able to receive it?
So the population eligible now are those with what's called systolic heart failure, which is about 2.2 million Americans. Systolic heart failure is where the pumping capacity of the heart is reduced, and those patients who have symptoms that are limiting their activity, so class 2 to 4 heart failure. It's expected to be about $12.50, and it's a drug that you would take twice a day, given with your standard heart failure regimen, but replaces ACE inhibitors and ARBs.
Next up, how fast are you aging? To answer that question, researchers tracked 1,038-year-olds going back a dozen years. Their study finds the pace at which we age covers a wide span. The subject's biological age ranged from under 30 to more than 60. I'm glad we're not demoing this one. I'm glad we're not doing a test of this one. But what's the difference between your biological age and your chronological age?
Sure. Well, chronological age we think of as our actual age, which is really a measure of time, how many years you've been alive. Biological age has more to do with your specific body, essentially how your cells are aging or deteriorating relative to others.
I can tell you how fast we're aging. Too fast. It's a really simple question. But how did scientists actually measure this?
Well, what they did was they took this group of 38-year-olds and they measured 18 different functional tests of aging. So some were blood tests that looked at deterioration of the organs. Others were more functional tests where they looked at, say, your metabolism, your physical fitness, or your memory. And what they found was that in this group of 38-year-olds, the age ranges, their biologic age ranges, ranged from 28 to 61. But more disturbing was that the physical appearance actually matched matched that.
Yeah.
So when a group of bystanders was asked to guess the subject's age, they guessed much closer to their biologic age rather than their real one. So if you were biologically 61, they looked at you and said, oh, they look about 61 rather than 38.
I thought it was so interesting, too, that they said 80% of it is not genetics. Because I always used to just say, oh, that's good genes.
Absolutely. I know. So twin studies have shown that really it's only 20% that's genetics, and the environment and other influences play into it. So the important things to remember are to stop smoking, keep a healthy waistline, eat a healthy diet, exercise, decrease stress, and at the end of the day, my plastic surgeon husband says there's always Botox, fillers, and facelifts. So.
For those who failed miserably at all the things you just listed. Oh, that's comforting. Finally, millions of Americans turn to online symptom checkers every year to try to find out what's bothering them. But how accurate are these tests? A new Harvard study finds they listed the correct diagnosis first in about only 34% of the cases. It appeared in the top 20 results about 58% of the time. We're not very good at this, I guess.
You just can't, you really can't replace the doctor. But I do think these apps can actually be useful, because one of the things, even if they miss the diagnosis, they can kind of give you a sense of the severity. So whether you can stay home, whether you need to call 911 or head straight to the hospital. So they do have a place.
That's really the most important thing, I think, is knowing when you actually have to seek care, not necessarily for getting the diagnosis right.
The problem is also the patients putting in the symptoms, too, right? To fact check it. That could be part of it, too. Dr. Holly Phillips, Dr. Narula, thank you both so much.